You arrive on scene to a patient who has fallen off of a roof. You dictate that the patient needs to be treated for apnea. What is the proper way to open the patient's airway? A. Head tilt, chin lift. B. Place your fingers at the teeth and push the mouth open. C. Jaw thrust. D. Slowly tilt the head as to not compromise the spine. A patient has left-sided heart failure. What kind of edema would the patient have? A. Pulmonary edema. B. Systemic edema. C. Pedal edema. D. Lower back edema. If there is a major open wound to the neck, what kind of dressing should be applied? A. A non-occlusive dressing. B. An all-sided occlusive dressing. C. A three-sided occlusive dressing. D. Gauze pads, followed by adhesive bandage. When the buttocks or lower extremities of a baby presents first during birth, this is called A. Breech birth. B. Placenta previa. C. Meconium. D. Precipitous delivery. Which of the following is the division point between the upper and lower airway? A. Pharynx. B. Oropharynx. C. Nasopharynx. D. Laryngopharynx. There are several dysrhythmias that can occur in the heart. Of the following, which is the most likely to lead to death? A. Ventricular fibrillation. B. P. C. Asystole. D. Ventricular tachycardia. What is the most effective way to stop an arterial bleed caused by a laceration to the hand? A. Elevate. B. Apply a tourniquet 2 inches above the wound. C. Apply a hemostatic agent. D. Apply direct pressure. You respond to a call for a psychologically disturbed patient in the middle of a mall parking lot. What is the best way to establish rapport with the patient? A. Explain why the story they're telling is wrong. B. Avoid eye contact. C. Speak loudly to get through to her. D. Speak slowly and clearly. A condition characterized by high blood pressure and high protein count in the urine that usually occurs after the 20th week of pregnancy is A. Preeclampsia. B. Eclampsia. C. Posteclampsia. D. Ectoeclampsia. Dispatch has notified you that the patient has tuberculosis. What precaution should you take? A. Wear a HEPA respirator. B. Wear a filtering facepiece. C. Wear an N95 respirator. D. Wear a surgical mask. You are managing an elderly female patient with a heart rate of 55 BPM. The most appropriate way to describe her heart rate is A. Tachycardia. B. Bradycardic. C. Normal. D. Slow. You have just been hired as an EMT on an ambulance where your partner is a paramedic. He decides to quiz you on the acronym DCAPBTLS. What does the C stand for? A. Crepitus. B. Cerebral. C. Contusions. D. Coronary. Which of the following is not part of the primary assessment for a patient who has been in a traumatic car accident? A. Ensuring a patent airway. B. Performing a rapid trauma assessment. C. Ensuring adequate ventilations. D. Assessing appropriate circulation. A patient with either type of diabetes has issue with what organs secreting what hormone? A. Pancreas and insulin. B. Pancreas and glucagon. C. Adrenal medulla and norepinephrine. D. Adrenal medulla and epinephrine. When analyzing the abdomen, what are the general signs you are looking for? A. Tenderness, guarding, lacerations, swelling. B. Guarding, letdown, aneurysms, defense mechanism. C. Pain, muscle lock, touch pain reflex. D. Tenderness, pain, rigidity, guarding, distension. The practice of protecting yourself from the patient's body fluids or bacteria is called A. Personal protective equipment. B. Scene safety. C. Wearing gloves and a protective gown. D. Body substance isolation. Which of the following signs would suggest a patient is experiencing anaphylaxis? A. Stridorous breathing. B. Tachycardia. C. Bradycardia. D. Bilateral wheezing. According to your county's protocol, you as an EMT are required to request medical direction via radio prior to the administration of prescribed nitroglycerin. This is called A. Differential diagnosing. B. Offline medical direction. C. Online medical direction. D. Radio medical direction. A patient who has experienced a DVT is at higher risk for what type of CVA? A. Intracerebral hemorrhage. B. Subarachnoid hemorrhage. C. TIA. D. Ischemic stroke. When a patient is breathing at a rapid rate and that breathing is shallow, the patient is at risk of A. Having low alveolar minute volume. B. Inhaling too much oxygen per minute. C. Having high amounts of tidal volume. D. Having low amounts of minute volume. Which of the following would indicate that a conscious patient is experiencing an obstructed upper airway? A. The patient's head is in the sniffing position. B. The patient is able to speak. C. The patient's chest is rising and falling equally bilaterally. D. There is no high-pitched sound when the patient breathes. When assessing a patient who may have experienced a stroke, you choose to use the Cincinnati Stroke Scale. Which of the following is not a part of this measure? A. Facial droop. B. Grip. C. Arm drift. D. Speech. After transporting a patient to the emergency department, where should you clean the patient compartment? A. En route to ambulance headquarters. B. At the hospital. C. At headquarters. D. Prior to arriving at the next call. You are interviewing a patient who tells you he had a previous surgical history of cholecystectomy. What is this patient referring to? A. The removal of a gastric ulcer. B. The removal of a portion of his colon. C. The removal of his gallbladder. D. The removal of a cyst from his colon. What cardiovascular disease causes crackles upon auscultation of lung sounds? A. Systemic edema caused by right-sided heart failure. B. Pulmonary edema caused by left-sided heart failure. C. The thoracic cavity has edema due to popped blood vessel. D. The patient sustained a head injury which is affecting the heart pump. In general, what is the area of safety in which EMS personnel should set up during a hazardous materials incident? A. Cold zone. B. Warm zone. C. Hot zone. D. Warm-hot zone. A 50-year-old male patient with known CAD and angina will likely have a prescription for A. Nitroglycerin. B. Both nitroglycerin and aspirin. C. Aspirin. D. Neither nitroglycerin nor aspirin. You are transporting a patient to dialysis when he becomes unconscious. Which intervention should you avoid? A. Taking his blood pressure using the arm without the fistula. B. Taking his blood pressure using the arm with the fistula. C. Ensuring an open airway. D. Supplying oxygen at 15 lpm. A male patient who was stabbed in the leg with a knife is losing a lot of blood. If this patient begins exhibiting symptoms of shock, what type of shock is he most likely experiencing? A. Hypovolemic. B. Hypervolemic. C. Distributive. D. Cardiologic. What valve opens during left ventricular contraction, and what valve closes? A. The bicuspid valve closes and the pulmonary valve opens. B. The bicuspid valve closes and aortic valve opens. C. The tricuspid valve closes and the pulmonary valves opens. D. The tricuspid valve opens and the pulmonary valve closes. When a patient experiences blunt trauma to the chest, such as a baseball to the chest, what are the patient's most likely potential injuries? A. Spontaneous pneumothorax and hemothorax. B. Tension hemothorax and spontaneous hemothorax. C. Tension pneumothorax and hemothorax. D. Spontaneous hemothorax and normal pneumothorax. While managing a 20-year-old male patient who has been in a car accident, he becomes unresponsive. Which technique would you be unlikely to use? A. Insert an OPA. B. Head tilt chin lift. C. Jaw thrust maneuver. D. Suctioning. What does the Q in the mnemonic OPQRST stand for, and what is this mnemonic used to identify in the field? A. Quality, rapid trauma assessment. B. Quality, the specifics of a patient's chief complaint. C. Questioning, mental status. D. Qualify, deciding where to transport the patient. In which situation is the use of a flow-restricted, oxygen-powered ventilation device contraindicated? A. In a patient without a suspected spine injury. B. In a patient with a suspected spine injury. C. In a geriatric patient. D. In a child or infant. Which organ is most likely to be most sensitive to a hypoglycemic diabetic emergency? A. Brain. B. Pancreas. C. Kidney. D. Stomach. A device that contains a specific amount of aerosol medicine that delivers it to the patient's lungs in bursts is called A. Metered dose inhaler. B. Aerosol chamber. C. Nebulizer. D. Masked inhalator. Which of the following serves as a blind insertion airway device that properly seals off the esophagus and provides a proper airway? A. Endotracheal tube. B. Tracheoesophageal tube. C. Dual lumen airway. D. Nasal cannula. Which of the following is not one of the three elements that make up the revised trauma score? A. Glasgow Coma Scale. B. Systolic blood pressure. C. Respiratory rate. D. Blood pressure. Which of the following interventions is of highest priority in a patient who is experiencing a probable myocardial infarction? A. Administer NTG. B. Administer oxygen. C. Attach AED and analyze rhythm. D. Insert OPA. A tracheostomy mask is a device that is used to provide oxygen to a patient with a stoma, and it provides A. 12-15 L of oxygen per minute. B. 8-10 L of oxygen per minute. C. 6-7 L of oxygen per minute. D. 1-6 L of oxygen per minute. Which of the following is not a branch of a single incident command system in the National Incident Management System? A. Operations. B. Planning. C. Organization. D. Finance administration. Which of the following mechanisms of injuries is least likely associated with a spinal injury? A. Low impact upon falling off of a bike. B. Being thrown out of a vehicle. C. A 20-foot fall from a tree. D. A baseball player who was hit in the head by a pitch. What is the appropriate device to use for an isolated midshaft femur fracture? A. Air splint. B. Traction splint. C. Pneumatic anti-shock garment. B. Femur splint. You arrive at a patient who has fallen off a ladder. Which of the following information is not important to the patient's care? A. Surface the patient landed on. B. What part of the body hit first? C. Height of the ladder. D. Distance the patient fell from. Where does blood travel when it leaves the right ventricle of the heart? A. To the pulmonary veins, then to the lungs. B. To the aorta, then out to the body. C. To the vena cava, then to the left atrium. D. To the pulmonary arteries, then to the lungs. The inability to move enough air required for adequate perfusion is known as what? A. Respiratory arrest. B. Respiratory failure. C. Cardiac failure. D. Pleurisy. Your patient is a 34-year-old male with a large laceration to the abdomen, and the abdominal organs are protruding from the wound. What is this type of injury called? A. Evisceration. B. Avulsion. C. Protrusion. D. Contusion.